Hello, everyone. For the beginning of today's lesson, I want you to review the information that we covered yesterday. That way, you can refresh the information. So, take a few minutes to review the questions from yesterday's assignment. You can pause the recording while you do this and then press play when you're ready to move on. So, today we're going to talk about the requirements to become an athletic trainer. So, in 1990, the American Medical Association officially recognized athletic training as an allied health profession, which made them an official healthcare provider. And this set forward a lot of changes in the field because with that recognition, it increased the standards to become an athletic trainer. And then in 2014, the Commission on Accreditation of Athletic Training Education, or CATE, was officially recognized by the Council for Higher Education Accreditation. So the CHEA is a private nonprofit organization that coordinates accreditation activity for colleges and universities in the United States. So recognition by the CHEA puts CATE on the same level as other national accreditors. And athletic training programs have been accredited for decades, but they weren't officially recognized by the CHEA until 2014. So it's a pretty recent change. So the primary components of professional practice are the aspects of athletic training that the athletic trainer really needs to focus on to be a highly skilled athletic trainer. So they should recognize that the primary focus of the practice should be the patient, and they should always do what's best for the patient. They need to understand that competent healthcare requires a team approach and understand when they should refer the patient to other healthcare providers. They need to be aware of the legal elements of practice in order to avoid lawsuits. They need to practice ethically so that they can always do the right thing, even when they face difficult situations and it could be tempting to do the wrong thing because it's easier. They should be dedicated to advancing the knowledge base in athletic training, whether that's by educating their patients or like the parents they work with about the field, or going into research as a college professor to improve the knowledge base for other athletic trainers. They should appreciate cultural diversity and realize that everyone comes from a different background and that we should accept people for their differences. And then they should be an advocate and a model for the athletic training profession. So they should strive to make sure that the athletic training profession is respected and that they do everything they can in their power to be a positive role model for the profession. So I want you to think about these questions. They are on your Google Classroom assignment. So while you think about this, you could also answer these three questions. You can pause this recording while you think about these questions, and then press play when you're ready to move on. So there are a few different requirements to become a certified athletic trainer. The most important one is making sure that you graduate from an accredited athletic training program. So in order to do that, you need to go to a school that has a degree in athletic training. Right now, some schools do still have a bachelor's degree in athletic training, but a lot of schools are moving to the master's degree. And so they've eliminated their bachelor's degree programs. Um, and so, for example, some of them still have the bachelor's degree program for the existing students who are already admitted to the school, but they aren't accepting new students to the program because all programs have to be a master's degree in the next few years. The guidelines for the requirements to become a certified athletic trainer are set by the Board of Certification. After you graduate from an accredited athletic training program, you're eligible to sit for the BOC exam. And in those athletic training programs, you go through a formal academic preparation in athletic training classes. So you take a wide variety of classes within the field of athletic training that strengthen your knowledge base for being an athletic trainer. And you'll take a wide variety of classes in those 5 domains we talked about yesterday. And you'll also do internship hours while you're in the program. The courses, a lot of them require about 1,200 hours of internship experience while you're still in the program. So these are the 8 content areas that the athletic training uh, programs focus on while you're an athletic training student in college. One of them is evidence-based practice, so using research to make your treatment decisions. Another one is prevention and health promotion, so how can you prevent injuries to your patients and how can you promote health and wellness to your patients? How to do clinical examination and diagnosis properly, how to properly do acute care of injury and illness, which is first aid and CPR, how to appropriately do therapeutic interventions, which is rehabilitation, how to appropriately do psychosocial strategies and referrals, which is providing emotional support and knowing when to refer your patient to a licensed mental health professional. Healthcare administration, so that involves record keeping, ordering supplies, and the other things we talked about yesterday. And then professional development and responsibilities. So, what do you need to do as an athletic trainer to be a role model in your field? So once you graduate from an accredited athletic training program, you can sit for the BOC exam. The exam is computer-based and it is similar to your state tests, where if you get the problem wrong, it gives you more questions. And if you get the problem right, it increases the difficulty of your questions. And then when you finish the exam, it gives you a score. A lot of the certifying exams are that way now. The EMT exam and the nursing exams are like that too. I have friends who have taken them recently, so that's why I know they're the same. Um, so if you get the problem wrong, it gives you more problems. If you get the question right, it increases the difficulty of the problems. And the exam is over once you've reached a passing score, or it's over when um, they've determined that there isn't any way for you to pass it. The exam assesses the 5 domains that we talked about in an earlier lesson. So the domains of injury and illness prevention and wellness protection, clinical evaluation and diagnosis, immediate and emergency care, treatment and rehabilitation, and then organizational and professional health and well-being. So you need to be well versed in those 5 domains in order to pass the exam. You learn all about them in the athletic training program, though. So as long as you do well in your classes and study before the exam, you won't have any problem passing it. Once you pass the BOC exam, you get certified as an athletic trainer, and you can put the credential of ATC after your name. So that means that you are a certified athletic trainer and you've met the requirements to become certified. And in most states, you need to be BOC certified as an athletic trainer in order to work as an athletic trainer. So we're going to talk about licensure and other regulation today. You'll see that not every state has this requirement. So I just want to show you guys like which programs are accredited in California. So you can see that Azusa Pacific University, which is in Los Angeles, is accredited and it has a master's degree. California Baptist University is accredited and it's a master's degree. That's in Riverside. Fresno State is voluntarily withdrawing their accreditation, so they won't have a program anymore. Cal State Fullerton in Orange County is in good standing and they have a master's. Long Beach State is in good standing and they have a master's. Cal State Northridge is on probation and they're changing their degree right now. Sacramento State is in good standing and they still have a bachelor's degree. Concordia University Irvine in Orange County is withdrawing their accreditation. Point Loma Nazarene University in San Diego is in good standing and they have a master's degree. San Diego State is in good standing. They have a bachelor's degree. San Jose State is in good standing and they have a bachelor's degree. University of Laverne is on probation and they have a master's degree. And then University of the Pacific, which is near Sacramento, is in good standing and they have a master's degree. So these are all of the programs in California that you can attend if you want to become a certified athletic trainer. So take a few minutes to review this question. What are the requirements to become a certified athletic trainer? You can pause the recording while you think about this and then press play when you're ready to continue. So now we're going to talk about the state regulation of the athletic trainer. So how do different states control who can work as an athletic trainer? During the early 1970s, the National Athletic Trainers Association realized that it was important for there to be some type of recognition by other medical professions as the athletic trainer being a healthcare professional. They knew that if the athletic trainer became recognized as a healthcare provider, that they would be more respected by the other healthcare professions and by the public. So in the 1970s is when NATA really started to push for this, and in 1990 is when athletic trainers got officially recognized as healthcare providers. Prior to this, laws that govern the practice of athletic training didn't exist in pretty much every state, but that's changed over the years, as you're about to find out. So in different states, there are different requirements for athletic trainers to work in the state. So some states require the athletic trainer to be licensed. Some states require the athletic trainer to be certified. Some states require the athletic trainer to register, and then there's one state that doesn't have any requirements for you to work as an athletic trainer. So 49 of the 50 states in the U.S. have formed some type of regulation that controls the practice of athletic training in their states. And even if you go from one state that has licensure to another state that has licensure, the rules and regulations will vary by each state. So, for example, if you work in Texas, you have to be licensed and you have to pass the certification exam by the BOC, and I believe you also have to pass an exam that's given by the state of Texas to become licensed in that state. So every state has different requirements. So there are various forms of regulation. These forms of regulation are also used in other healthcare professions. So, for example, to be like a doctor, you have to be licensed. To be an EMT, you have to be certified. So there are various forms of regulation for all the healthcare providers. So licensure, what this does is it limits the practice of athletic training to those who have met minimum requirements established by a state licensing board. So the state government decides what those requirements are, and then it limits the number of individuals who can perform the functions related to athletic training as dictated by the Practice Act for that state. So you have to apply for licensure. You have to meet all the requirements and you have to pay a fee. It's the most restrictive of all forms of regulation. It limits what you can do as an athletic trainer, and it limits who can call themselves an athletic trainer in that state. And in those states, you have to be licensed in order to call yourself an athletic trainer. So certification is another form of state regulation for the healthcare professions. It does not restrict using the title of athletic trainer to only those certified by the states. So if you are certified as an athletic trainer through the BOC, but you didn't apply to the state to become certified through the state, you could technically still call yourself an athletic trainer. It can restrict the performance though. So if you became certified by the BOC and you hold the title of certified athletic trainer, if you're in a state that requires certification and you don't apply to be certified with the state, then you actually can't do the job functions of an athletic trainer until you've applied for certification with that state. So it does restrict the performance of what you can do on the job. And then registration is another form. Before an individual can practice athletic training, they need to register in the state. They have to pay a fee to the state and apply, but it doesn't say anything about competency. For example, they don't have to pass an exam with the state in order to register with the state. So it's not as restrictive as licensure. Legislation that controls the practice of athletic training has been positive, and it does help protect the athletic trainer from getting sued. Because if people know that the athletic trainer is more qualified, they're less likely to sue. But then also, when there is legislation from the state in the law, there can be some rules that help limit the chances of the athletic trainer being sued because it protects them. So here's a picture from the Board of Certification website, and currently 49 states regulate the practice of athletic training. So you can see this really light blue is no regulation. California is the only state that doesn't regulate the practice of athletic training. So in California, anyone can become an athletic trainer as long as the organization is willing to hire them. There's no minimum education requirement. There's no certification requirement in California. So California is the only state without regulation. However, they are trying to get a law passed that does require registration in the state, which would limit who could call themselves an athletic trainer in the state. And then you can see the blue, that's the second lightest, is licensure. And as you can see, most of the states use licensure. And that one was the most restrictive form of regulation of all the types of regulation. The next darkest is certification, and it looks like only South Carolina and New York use certification. And then the darkest one was registration, and it looks like Hawaii is the only state that uses registration. However, registration is the form of regulation that California is trying to enact in the state. So if California passes that law, then California and Hawaii will be the only states that use registration. So now I want you to think about the information I just told you. What are the different types of state regulation used for athletic training? I want you to describe each one when you answer these questions. So right now, just think about it. You can pause the recording and then press play when you're ready to finish it.